Talking about implementation can seem vague and mysterious for some, but it's more straightforward than you might think, or than you might imagine if you have ever read an implementation science research paper. Recognizing that no definition is perfect and all encapsulating, we are proposing that these definitions apply to our understanding of healthcare innovation, research, and implementation activities. So they are that applied health research is about closing the gap between evidence and practice. It includes a focus on addressing the health and care needs in the region, and with a focus on implementation and dissemination. Innovation is any creative response to a challenge. It might be a new product, a new technology, a new service, a new way of doing things. It may be an innovative combination of existing ideas or implementing them in a new setting. Implementation is different from implementation science. Implementation is the process of putting something into effect. In the case of innovation in health and care, it refers to the process of changing practice. This could be due to a new pathway, the use of a new technology, or to reflect a new guideline, policy, or procedure. The implementation of innovation in health and care settings happens every day and is often led by clinical or operational teams in provider organisations. Implementation science is the study of implementation to better inform implementation practice. It is useful to have an understanding of the practical tools coming out of implementation science if you are implementing something, but they should not be restrictive. It may be helpful to do some language busting too. The intervention, practice, or innovation can be referred to as the thing. Effectiveness research looks at whether the thing works. Implementation research looks at how best to do the thing. Implementation strategies are the things we do to try to help people and places do the thing. And implementation outcomes are how much and how well people and places do the thing. Eastern AHSN draws on principles of implementation science to implement a range of innovations across the healthcare system. Our project TCAM, which stands for Transfers of Care Around Medicines, involved hospitals sending a patient's discharge information to their local pharmacy so the pharmacy could support them with any new medication when they got home. In order to be successful, pharmacies, local pharmaceutical committees and hospitals all had to work together to implement a new digital system and communicate on a regular basis. This was a national project, meaning all 15 AHSNs in the country supported it in their area, and the AHSN role was vital in facilitating cross-sector collaboration. So what did we do? We established a community of practice for all sites in the region, so best practice and implementation progress could be shared, facilitating shared learning. We analysed data from each site so that we could monitor and support performance. We worked closely with local pharmaceutical committees, or LPCs, so they could support their local pharmacies in actioning referrals. We did this by helping them use the data to identify the pharmacies that needed support, so they could reach out directly. We provided conditional funding to the LPCs to support this function. We convened all implementation meetings, bringing together the innovator, the implementing trust, and the relevant LPC, so processes could be developed jointly. As part of this, we ensured there was a lead or champion at each organisation, most often the chief pharmacist at the trust and the chief officer at the LPC. We provided funding to trusts to cover the first year of their licence to use the innovation. We funded community pharmacy engagement events for each trust. Typically held in the evening, these events were organised by LPCs and consisted of presentations from the LPC, the implementing trust, the AHSN, which covered the evidence base for the innovation, and a practical demonstration of what pharmacies need to do to action referrals. We held lessons learned sessions at every trust in order to reflect on how implementation could be improved, and we programme managed the whole effort, providing ad hoc support and guidance to all participating organisations throughout. These were our implementation strategies. Although we did not formally use an implementation theory or framework in planning this work, the implementation strategies we used clearly map onto existing frameworks. For example, from the Expert Recommendations for Implementing Change, or ERIC framework, we identified and prepared champions, we informed and consulted local opinion leaders, we conducted educational meetings, we captured and shared local knowledge, we conducted educational outreach visits, we audited and provided feedback, we reminded and supported clinicians, we used payment schemes, and we changed physical structure and equipment. Some models and frameworks specifically provide a step-by-step guide to support implementation, which can be useful in the right context. Determinant frameworks, such as the ERIC framework, identify types of determinants or factors that act as barriers and enablers that influence implementation outcomes to help you effectively plan implementation strategies. This table provides a summary of different types of theories, models, and frameworks. There's process models, determinant frameworks, classic theories, implementation theories, and evaluation frameworks. Process models and determinant frameworks can provide the most practical tools to support implementation. Process models can specify steps and stages and phases in implementation, and as just mentioned, determinant frameworks help you identify barriers and enablers that influence implementation outcomes. Not every implementation requires the use of a theory, model, or framework. However, for large-scale implementation activities, it may be useful to consider how a tool or framework could help organize a systematic approach to implementation, which takes the context and intervention into account. Eastern AHSN can support you to select an appropriate tool or framework where appropriate to do so. There are also a number of practical tools and resources to support this, such as TCAST, an implementation theory comparison and selection tool, and the CFAIR-ERIC barrier buster tool. It is important to think about implementation at the outset of a research project, particularly when writing grant applications. Key things to consider at this stage are: will there be an intervention to be implemented? What are the core parts of the intervention and what could be changed/tailored to fit the local context? In what context will the innovation be implemented and what challenges may be faced? Are there any theories, tools, or frameworks that would be particularly helpful in supporting an approach to implementation? Eastern AHSN can help you think through all of these things and particularly select a theory, tool, or framework that might be most helpful. If you would like to request AHSN support, please complete this online form.